But anyways, the purpose of this video is to kind of tell you what you need to do after your surgery to make sure that everything heals up correctly. So let's start first with symptoms and what you should be expecting afterwards. Okay, so you're going to be in pain for the first 24 hours. Sometimes it's a little bit more than that if you know, bone grafting was done. So basically, chances are it's going to suck for the first 3 days. I'm sorry. But I mean, I'm hoping that you're not in pain anywhere between 10 and 14 days after it was done. Although I do want to mention one thing. If you have an increase in pain around 3 days to 7 days, you know, a dramatic increase. You know, you had it taken out on day one, it hurt day two, and then it started to get better, and then boom, it started to go back up. And then you've got some swelling and you just generally don't feel good. You may have a post-op infection. You should probably call the office. As far as bleeding goes, expect to bleed in the first 24 hours. I just took out a tooth. You may even bleed for the second day. And when you start to rinse your mouth afterwards, some of this mouthwash or whatever, or saliva, is going to mix with the blood, and it's going to make it look like there's a whole lot more than there is. So unless you're profusely hemorrhaging on day two, chances are you're fine. But if you are, call the office. Okay, swelling. Expect to swell a little bit. If bone grafting is done, definitely expect to swell. Swelling usually, most of the patients say it's the worst around day two, but you should have some swelling for the first 4 days or so after the tooth was taken out, unless it was just a simple extraction, in which case you should have minimal swelling. And again, just like for the pain, if the swelling increases from 3 to 7 days, increases dramatically, you may have a post-op infection and you might want to give our office a call. Bruising generally doesn't happen if it's just a single extraction, but if bone grafting was done or if multiple teeth were extracted, you'll probably have a little bruising. Bruising shows up generally around 2 to 3 days. Most of the time it's gone by 7. If it is a big bone graft, maybe around for 14 days afterwards. But by day 14, it's almost nothing, just a hint of it. Okay. Sutures. In our office, we use 2 types. There's dissolving types and there's non-dissolving types. There's a whole lot of other dissolving and non-dissolving types as well. But for the purpose of this video, if you had dissolving sutures put in, chances are no one needs to take those out. They're going to come out on their own. They'll come out anywhere between 2 days and 2 weeks after the surgery was performed. If they're the type that don't dissolve, we're going to be taking them out at your 2-week post-op, or they may stay in place for 6 weeks. Kind of depends on whatever procedure was done, up to 6 weeks. Okay, so let's talk about some strict no-can-do stuff. Absolutely no rinsing for the first day. You can start rinsing the second day. Rinsing should never be done vigorously, the traditional type, because that's going to disrupt the clot, or it may move the bone graft material around, which is a bad thing. Rinsing should be done simply by placing that tablespoon of whatever you're using. It may be prescription mouthwash, it may be Listerine, it may be warm salt water. Put that stuff in your mouth for 30 seconds, just bob your head back and forth. This just bathes the extraction socket in rinse, but doesn't disrupt anything. Don't suck through a straw. Don't touch the surgical site. I mean, don't even pull on your lip to look at it. All of these things could move stuff around, disrupt a clot, and that would be terrible, because then maybe you get a dry socket, or worse yet, an infection, and bone graft and stuff moves around. So those two, the sucking through the straw and touching the surgical site, don't do that for the first 2 weeks. And then as far as a water pick goes, don't use a water pick for the first 3 months in that area after surgery was performed. 3 months. Absolutely no exercise. This means don't do yard work, don't mow the lawn, don't do laundry. Might be okay as long as you're not bending over, because that would cause the increase in bleeding, and that'd be a terrible thing for you to have happen. Essentially, just be a couch potato for the first 3 days. That'd be really great. Don't do anything. You'll heal much better. Okay? No hot foods or hot liquids. Especially in the first 24 hours. I mean, stick to only cold. You know, hot liquids tend to disrupt stuff or dissolve sutures too fast, and it's just something we want to avoid. And then I think this one goes without saying, but don't smoke or drink alcohol for at least 3 days after the tooth was extracted. You know, smoking should, I mean, don't smoke at all if you can, because it's going to slow down the healing process, and the end result's not going to be as good. Okay, no spicy foods, no chips, no nuts, popcorn, even rice, stuff that could get down in the socket. Acidic beverages like Orange juice, grapefruit juice, avoid those. Carbonated beverages, avoid those. On all that stuff, avoid it for the first 14 days. Okay, so what are some things that you should be doing to improve your healing? Well, directly after you leave, keep some pressure on that socket. It needs to be gentle but firm. We've got a 2x2 gauze wrapped up and stuffed in there, and just lightly biting down on that, you know, that's definitely going to stop the bleeding. Well, not definitely, but 9 times out of 10 it'll stop the bleeding. Every now and then we'll have a patient that bleeds just a little bit more afterwards. In this case, you can change the gauze about an hour afterwards. Don't change the gauze too frequently though. The more frequently you change the gauze, you just keep pulling and disrupting the clot. So here's my recommendation. Don't take the gauze out for the first hour to 2 hours after we put it in and after you left the office. Then you can change it every 30 to 45 minutes. Don't use dry gauze. Don't use soaking wet gauze. It's damp somewhere in the middle. Place that into the socket and then firmly press down, bite down on it. You could use a tea bag, like a moist tea bag as well. That would also work. Okay, so as far as cold therapy goes, we're going to give you a cold pack when you leave the office, but it doesn't last that long. The chemical ones just don't work that well. So you need to go home, get a real ice pack out of your freezer, and then, or frozen peas, whatever you're going to use. It's all great. Just wrap a towel over it and place that over the site. Do it 20 minutes on, 20 minutes off, and you can do that for the first 24 to 36 hours. Okay? After that, you need to switch to warm stuff. As far as medications go, I wanted you to take all of your medications as I prescribed. The only exception to that is the post-operative narcotic type pain medications. You don't have to take those if you're not in pain. You know, we also generally prescribe ibuprofen with this as well. Unless you have a medical condition where you can't take ibuprofen, I kind of recommend taking that. And start it right before you leave the office. That'd be great because then you've got some you know, you've got some pain medication on board and you stay ahead of the pain as we put it in the field. Ibuprofen also decreases swelling too, which is something you're probably going to want. Okay, as far as oral hygiene goes, we talked a little bit about rinsing before. Don't rinse your mouth for the first 24 hours. Afterwards, rinse very, very lightly with whatever we've instructed you to use for a rinse. As far as brushing goes, you can brush the first day, but be careful, don't touch the surgical site. And if you are going to brush the surgical site after the first day, which it's okay to do, I shouldn't say brush the surgical site, brush the teeth next to it. Don't brush the socket. That's not going to do you any good, but mess with the healing of the socket. So instead, try to keep the areas around it nice and clean if you can, but be very careful. Use a very, very soft toothbrush. It's probably a bad idea to use an ultrasonic toothbrush directly next to the socket after I took out that tooth, especially if there was bone grafting done. Now, as far as flossing goes, I'd recommend flossing like you normally would. Just make sure that you don't floss the sites directly adjacent to where the tooth was extracted. Okay, finally let's talk about diet, and let's split diet into the first 24 hours and then after 24 hours. So in the first 24 hours, really the only difference between the two is the temperature of the food and stuff that you're drinking. So make sure that in the first 24 hours everything is cold. You know, you got an ice pack on the outside of your jaw, you're drinking cold fluids. I mean, you kind of get the theme here. Some examples of things that you could drink would be protein shakes or smoothies. Blending ice, bananas, berries, stuff like that. Maybe add a little protein powder to that. That'd be a phenomenal meal, you know, directly after you had surgery. You could also do iced tea. You could do milk, milkshakes, nutritional supplement shakes like Boost or Ensure. Stuff like that works out great. As far as real food goes, stick to just cold stuff. Cold soup, cold pasta, mashed potatoes. Those three are great for the first 24 hours. If you have to have a little dessert, you could do yogurt, you could do applesauce, you could do pudding, jello, stuff like that as long as it's cold. Right? Then after 24 hours or 36 hours, somewhere in there, you can switch to warmer foods. But for the first week, keep it only warm. I mean, I don't want you eating anything hot for at least the first 14 days. So same consistency of food. Some examples of warm foods that you could eat though would be like stew, crock pot recipes, just slow cooked vegetables, slow cooked meat. You know, a rule of thumb for the first 2 weeks, and if you had bone grafting done for the first 3 months, is if you can pinch through it, you're allowed to eat it. But if you can't pinch through it, you shouldn't be eating it. Oh, and speaking of that, so for the next you know, 2 weeks or so, and if bone grafting is done the next 3 months, make sure to eat on the opposite side that the extraction was done on. we're trying to eliminate any pressure or movement of the bone grafting or the socket where things are healing, especially in the first 2 weeks. You don't want something to get stuck up in there either. That puts you at risk for an infection. But I guess if you've had extractions done throughout your entire mouth, that this rule can't really apply. If that's the case, then you need to just make sure that your diet is as soft as possible. And if bone grafting is done, it needs to be soft for at least 3 months. So that pretty much sums up what we wanted to talk about today. Basically, we reviewed the symptoms, what you should expect, strict no-can-dos, what you should be doing, and then a little bit on diet. Hopefully this video really helps you out, because you and I both want your healing results to be awesome. And with that being said, I hope you are off to a fast and successful recovery.